The eye is the only place in the body that we're able to see active blood vessels without having to cut anything. There's actual manifestations that you can see in the retina.
Dr. Monique Mohammed-Weeks is a respected optometrist sharing her experiences, perspective, and purpose behind her work. This conversation explores a life shaped by service, impact, and intentional care.
If someone has diabetes, high blood pressure, HIV, there are certain changes in the back of the eye that you can see. So it's really important that people understand that your eye health is connected to your overall health.
Welcome to the Refined Brew Collective. I'm your host, Ashley. This is a safe space for real conversations, thoughtful reflection, and intentional growth. So grab your coffee and let's sip, reflect, and rise together. Hello, everyone, and welcome back to another episode of the Refined Brew Collective. I'm your host, Ashley, and today I'm joined by an incredible guest, Dr. Monique Mohammed-Weeks.
Hello.
Dr. Monique Mohammed-Weeks is a highly credentialed doctor of optometry, a fellow of the American Academy of Optometry, a diplomat of the American Board of Optometry, a wife, and a devoted mother of two. Her career reflects excellence, service, and leadership. Here at the Refined Brew Collective, we like to give our guests their flowers while they are alive and thriving. Can everyone join me in giving Monique her flowers?
Thank you. Thank you.
So, before we dive into your personal journey, I want to set the stage for our listeners who may not be familiar with the field of optometry. Optometry is a healthcare profession focused on the science of vision and eye health, including prescribing corrective lenses, diagnosing, and ocular diseases. The field involves a deep study of human biology, ocular health, vision science, and pathology. So, with that foundation in mind, Monique, let's rewind. When was the moment you knew you wanted to become an eye doctor, and what first sparked that calling?
So I actually didn't know that I wanted to become an eye doctor. I always knew that I wanted to be a doctor. But during my senior year of undergrad, I did a internship at SUNY College of Optometry, which is the school that I ended up going to. They had a internship program. Essentially, it was some classes and also a clinical rotation through their clinic where we got to observe some of the third and fourth year students as they were seeing patients. And that really sparked my interest. There were a lot of women optometrists in the school, and just in general, optometry now has more women than it did in the past. So I just really gravitated to seeing a lot of women who were mothers. A lot of the professors were mothers and wives, and they spoke very highly about being able to have a great work-life balance. And that was something that I've always wanted. So that's really what drew me to optometry. And then also it was a very pleasant doctor experience. Like most people were happy to come to the doctor. They were either getting their contacts or getting their glasses. So it was overall like a very pleasurable experience. A lot of the patients were happy to be there compared to some other professions where maybe, the patients aren't as happy to be sitting in your chair. So I had a really good experience. And that really kind of just made me want to get into the field.
That's really nice. So, what was the other field that you were looking into if it wasn't optometry?
General medicine. So like going to medical school, I didn't have a particular thing that I was interested in. It was either to go to optometry school or consider like going to med school. But yeah.
How did your family background influence the way that you approached your education and career?
So I'm first generation American, both of my parents from Trinidad and Jamaica. So I think having that very heavy Caribbean background, like like me being a doctor or me being educated wasn't really an option. I didn't have a say. It was more like, no, this is what you're going to do. So it was either a lawyer, a doctor, and that was my only two options. So my family background definitely, the way that they viewed it was, we came to America for you to have this opportunity. So it's very important that you make the most out of it because a lot of people don't have this opportunity. So I viewed my educational path as well as my future career as a way to really show appreciation to them for all that they've done for me. But also, they presented it as like, this is the way that you can make a difference in your life. And given this opportunity, you can just have a way better life financially to show how much you have appreciative of us by making sure that you're staying in school and doing what's going to set you apart and make your life better than what theirs was compared to where they were at my age. So that background really influenced just how I viewed education. And even now, like as a mom, how I view education is very much skewed in that way because I understand how much education is actually very, very important. Not even pursuing to become a doctor, but just like being knowledgeable about different things and the importance of taking your education seriously, regardless of what you pursue. So yeah, that background definitely steered me towards this direction that I'm in now.
Did you feel that being an only child, it gave you that additional pressure that you needed to stick the path and not kind of look elsewhere or try to do something different?
I do feel like being an only child, there's a lot of pressure, more so because if I wanted to do something outside of what they wanted me to do, it was like, but we don't like it was very clear that
Mhm.
I needed to stay on a certain path and anything else was not going to be okay with them. But yeah, I definitely feel like first and foremost, like being first generation Caribbean, like, Jamaican Trini, like I think that had a huge impact on my educational path. But I also think like being an only child, it was almost like they viewed me as like their prodigy in a sense, and like this is our one child and we have to show that like we raised her right, so she has to be educated and she has to be doing good things. So yeah, there's definitely a lot of pressure there. And then I also think that being Black, I felt a lot of pressure because as I got further along in my education, it was very few of us. So then
Mhm.
I felt even more pressure just internally, to not want to be the one that failed or wanted to make sure that like I succeeded. So there was just a lot of like external as well as like internal pressures, a lot of feeling that imposter syndrome of like, do I really belong here? Like, am I really gonna, a lot of that specifically as I got like higher up through my education. But yeah, so it's a little bit of everything that really kind of feels that pressure, I would say.
I'm really proud of you for sticking it through. So, what optometry programs did you apply to, and what was your selection criteria?
So, I live in New York. First and foremost, like I really wanted to stay in New York. Like I never left home until I got married. So my whole world was really New York. And I think for me, because there was an optometry school in Manhattan, I knew that I wanted to stay as close to home as possible. And I didn't want to have to like live outside of home because I really just had never experienced it. So it just was a very fearful idea to do. So I applied to SUNY College of Optometry, which is in Manhattan. I also applied to a school in Ohio because I also did an internship program out there. And that opened my eyes to like the possibility of living somewhere else. I was really open to moving there, as well as a program in Pennsylvania, because I figured those were all relatively close. Ultimately, I ended up choosing, or when I was applying, once I got into SUNY, I ended up deciding like I'm not going to interview anywhere else because I knew that I really wanted to go there because it was so close to home. Most of the programs, for the most part, are very similar in terms of you're going to get a great optometric education, whatever optometry school that you go to. There are some things that I looked for. So, particularly like making sure that the school had very high pass scores, meaning you have to take your boards at the end of optometry school. And I wanted to go to a school that had a track record of most of their students passing the boards on the first time. So that was important. That's another reason why I went to SUNY because SUNY's has very high pass scores compared to some other schools. And then also some of the other programs in the school, like most of the schools have affiliated with great residency programs. I did a residency when I graduated optometry school. So it was kind of all those little things. I think the biggest thing for me was like wanting to be close to home. I didn't want my first experience living outside of the home to be in optometry school because there was just so much pressure getting through the program in and of itself. But yeah, so those are some of the things that I looked for to see if I was going to apply to the school or not.
How was the scholarship and grants process for you? Did you find it difficult to obtain those?
So for optometry school, from what I can remember, when I applied, they have a financial aid department. So essentially when you applied, you would qualify for whatever they had available. It wasn't necessarily something that I applied to, at least going into optometry school. I do believe there were some people that were able to get additional scholarships that were available after they got in that you had to apply for. But most of the scholarships are based off of I think either merit or need. At least I
Okay.
would say that's what I remember. Because I lived at home and I was a New York State resident, the tuition is already a little bit cheaper compared to like if you were living out of state, then it'd be considered private. But then also one of the organizations I was a part of, NOSA, the National Optometric Student Association, I got a scholarship through them at the end when I was leaving. So there was many ways along the way where if you needed to gain extra money, like through work study or, through different scholarships, there were opportunities to kind of get some of that money if you needed.
Okay.
Mhm.
So we briefly touched a little bit earlier about how you felt like you stood out within the program. Could we talk about that a little more and how you found community?
So I would say that in general, for me at least, it felt a little difficult because I don't think there was many Black people in my program. Very, very few. The class was 100. So there just wasn't a lot of community in that sense in terms of diversity. But I will say that I was able to find community just based off of the amount of different extracurricular activities or different clubs. For me, I think that's a great way to meet people. There was different organizations, student-led organizations in optometry school, and you just basically find people based off of common interest, essentially. So when I was a part of NOSA, I was able to meet people and make a connection there. At SUNY, they have a great program that they essentially pair you with it's called a big. So essentially when you come in as a freshman or a first year student, they pair you with a second year based off of like common interests. So when you are first starting, you're paired with a second year that acts as your big. It's almost like a mentor. And however you choose to have that relationship in terms of if you want them to, like my big ended up being the one of the maid of honors at my wedding. So we created like a lifelong friendship because she looked like me. She was also Caribbean. So we had a lot of different things that connected like on a personal level. And that was really nice. And a lot of people that I know that had their bigs also connected on a personal level because they did ask you a lot of questions before they matched you with someone. So I felt like that was a great way for me to create community. Also, they had another organization. I'm a Christian, so they had the Fellowship of Christian Optometrists. That was an organization on campus at the school. So I was able to also meet some other people through there. So even though I wasn't able to find a lot of people that looked like me, I was thankful that there was a lot of other organizations that I was able to find people that had similar interests and then develop friendships through there, which is also really important.
I agree. That's beautiful. To add to what we were talking about before in regards to the clubs and activities that you've joined, what additional resources did you use during your program that were most valuable and are still relevant now during your path to becoming an optometrist?
So I would say definitely the National Optometric Student Association. So once you graduate, it's just called the National Optometric Association. But I'm a member of that. I'm connected with several doctors through that organization. That helps with a lot of the connections and networking. I would say once you finish optometry school and you're licensed and you're working, the most valuable thing is just being connected to other doctors that can help you in whatever way that, if you need mentorship, if clinical stuff, like networking is just, I think is very important in optometry just to feel a sense of community. So you don't feel like you don't have anyone to talk to that's also an optometrist, if that makes sense. So I think NOSA was really, really great for me because it connected me with alumni, connected me with optometrists while I was a student. So I was able to develop those connections. So when I graduated, I'm still able to maintain those connections, and also just anyone that's also in that organization, just being very helpful to new optometrists, young ODs or young optometrists. So that was really helpful. The Fellowship of Christian Optometrists was great. There were organizations that did mission trips within optometry, and I felt like those also were valuable just in terms of great sense of purpose, at least for me when I do them. The Lions Club, they do missions trips. The organization I went with was the Eye Health Institute. I can't remember the name, but that was an organization that I did a mission trip through to Jamaica. So I think those are really great things to be a part of. And I think it just solidifies your passion, which I think is always important when you're going to be in such an extensive program that's going to take up so much of your time. You want to make sure that you're doing things along the way that just re-solidify why you're doing this, because it does get really challenging academically along the way. So that kind of re-invoke that passion in you is really important.
How soon into the program were you looking or seeking for internships?
So not necessarily internships. Like once you're in the program, I wasn't looking for internships, so to speak. But in terms of like the extracurricular, like the clubs, they really encourage you to be involved. It makes your experience much better, in my opinion. You tend to have more fun, and having fun along the way, like I said, is also very important. But in school, we had a lunch hour from 12 to 1. So most of the clubs would have their meetings during that time because they want to encourage people to come to their lunch meetings. Everyone wants free food, right? Like they do things to kind of introduce you to those things. They would have different events so that you could meet different people from the different clubs. So I would say that once I started, I already knew about NOSA because I was involved in C-STEP. That was the name of the internship that I did when I was a student. I knew that I wanted to be involved in that because that was what helped me to become interested in optometry. It was really early on as a first year. I was already on the board of NOSA. I think I was a first year liaison when I was a first year student. So I was already wanting to be involved because I knew how much it had helped me to kind of come to optometry school. And NOSA, which is why it's important for me to still be a part of it, really focuses on advancing the eye health in communities that are or minority populations. So that was one of the main reasons why I stayed on the board all 4 years because it was really personal for me to be a part of that.
So, to touch on what we were talking about before in regards to the missionary trips, you also went to Guatemala in addition to Jamaica. How have those experiences shaped you as both a doctor and a person?
So the trip that I went to Guatemala was a missions trip through my church, and the Jamaica trip was a optometry-led mission trip. So we were there to give eye exams, help people with getting glasses, people that had glaucoma, we were giving them, their eye drops. So there were two very different trips, and I think they both, I guess, fueled my passions differently. So with Guatemala, I think it really gave me a deeper appreciation for life, just being able to help people. A lot of times when you think you're going on these mission trips, you think that your sole purpose is to help other people. But I always feel like, at least when I went on both of those trips, it's almost like they helped me in a sense. So like when I went to Guatemala, I came back feeling more appreciative. They showed me what true appreciation is, in the sense of having very little and still being very filled with joy. That's what I learned the most from that trip. People that had not as much as what I have here, yet they had more joy than I felt I had. And it's interesting to think of it that way, but I came back a better person because they helped me discover a different part of myself versus me just going there to help them. So I think that really shaped me now, especially as a mom. What does it mean to cultivate an atmosphere of joy, like in your life, right? Like it's not based on your circumstances. There should be a level of joy that a person has regardless of what they're going through. And that's very different from happiness that can be very temporary. So it's like differentiating between those two things was again something that like I just really found great joy in the trip, but also just knowing that I was helping people was a great experience. I personally really like missionary type things. Even when I can't go internationally, being able to help people locally is something that I do enjoy doing. Jamaica was really nice too. And that was a little bit different because I'm half Jamaican. So I really wanted to go because it felt like I was giving back to a part of like my culture. Um, which was really important to me. I love optometry, and being able to do that in Jamaica was just like I was in heaven. Like I was like, I want to do this all the time. And my plan was to go back and do it more than the one time that I did. But then, when I finished optometry school, getting married and having kids, it was not a stop, but a pause in things. Um, so that trip also, like I said, spoke to me because again, it's similar to Guatemala, just being around people that don't have a lot and yet they have more joy and happiness than you is very telling that material things don't bring you peace, right? Like they don't. It brings us this temporary sense of fulfillment. But when you're around someone that has less and they can smile bigger than you, or they can just have so much love in their heart and they don't have half of the material things you have, it's a very eye opening experience to really look within yourself that why are you so attached to your material things that you don't have this, peace and joy that people that don't have material things are able to have. So those were both great missionary experiences. I feel like everyone should go on at least one missionary trip in their life because it's just a very humbling experience. And I'm very grateful to be able to have done those for sure.
Missionary trips and just volunteering in general.
For sure. There's a part of our lives purpose that's meant to give back. It's a fulfilling thing to do.
I agree. So, medicine is evolving rapidly. Let's talk about what it looks like when all that training meets real patients. How do you keep up with medicine as it's always evolving?
So, as an optometrist and most medical professionals, they have to do a certain number of continuing medical education hours. And that's something that definitely keeps you up to date with all the new technology. As AI begins to become integrated into these machines, you get to be more aware of these things as they're happening. So, I just attend many different CE lectures, which are an hour for each topic, let's say. And if I have to do 36 hours over the course of 3 years, then that's how I'm able to keep up with different changes in medicine. I do see kids as well. If there's any changes in like pediatric care regarding like prescription glasses, let's just say, then how that changes being able to go to those CEs will change how you practice. Also, there's tons and tons of research that's done all throughout the year regarding different parts of optometry from different parts of the eye, from the cornea. There's research that comes out through the retina. So there's different things that you can read up on articles as well. And that's also very important because as these research articles come out, sometimes the research article will say, there should be a change in the way that you practice regarding this particular disease. So it's important to read those articles because that can also change how you practice, right? As you learn these new things that are being done in clinical research.
Do you attend seminars as well?
Well, they're the same thing as like continuing medical education.
Oh, okay. Good
But
to know.
yeah, I have to attend to maintain my like license. You have to attend a certain number of hours.
I wanted to go back in regards to the program and touch a little bit more on that. How did you prepare yourself to have the competitive edge hospitals and practices look for?
You're talking about when I finished optometry school, like wanting to start working. So the main thing is I just did a residency. most hospitals will hire you if you have a residency, of course, depending on what the residency was in and depending on what kind of position you're going for. But I always knew I wanted to do a residency because I wanted to be in a hospital-like setting or a community health setting. Community health is essentially like an outpatient clinic. Most of those settings want you to have a residency. So residencies aren't required as of yet in optometry. Once you graduate in optometry school, you've essentially learned from the front of the eye to the back of the eye, from pediatrics to geriatrics, contact lenses. You've learned everything in varying degrees, and you're able to then just go and practice. But for hospital settings that may be a little more critical care in terms of having more of an ocular disease or they treating more pathology, they may want people that have a residency in ocular disease. So I did my residency in ocular disease and primary care because I knew that I wanted to work in those settings and I didn't want a limitation to be that I didn't do a residency. So depending on if you want to do hospital setting, to be competitive, you just need to do a residency, essentially. And then make sure that you just had a good residency experience because that's going to translate to recommendation letters and those types of things. But I think having a residency will give you that competitive edge. If I was really interested in contact lenses and I wanted to work in a private practice, I may not necessarily do a residency because not most private practices don't require that. But if I wanted to work, let's say, in a hospital that specialized in like specialty contact lenses or a cornea practice that specialized in different sorts of corneal diseases that patients may need contact lenses, then maybe I would do a residency to give me an edge over someone that didn't do residency to show that I can manage these different pathologies regarding the cornea, just as an example. So for most people, depending on the setting you want to go into, residencies are very helpful to give you that competitive edge. I work in a hospital now, which is where I've always wanted to work. So for me, I would not have gotten this job if I didn't have a residency. Also, as the demographic of our population changes in terms of people are going to be getting older, there's going to be some sort of pathology that's going to be happening. So as that changes and optometry becomes more medically geared in terms of patients that have diabetes and checking for diabetic changes in their eye or high blood pressure, I think it's really important to do residency just to be ahead of being able to be comfortable managing these things. But again, it really depends on the setting you're going to be in after to determine if you really need it or not.
Can you share your study practices for the licensing exam and key resources that you used?
Yes. So optometry school is 4 years. The first 2 years is didactic, so it's mainly lectures. The third year you have lectures, but you do more clinic. And the fourth year, you're not really in any lectures and you're just doing clinic, your internship rotations. So of course, your most important resource is just do your best, take good notes and to compile your information from day one of optometry school. Because essentially your exam that you take in fourth year is compiling, or your first exam, part one, that you take in third year is compiling everything from first year. So it's a lot of information that you have to synthesize in your brain for the first exam. So the most important thing is make sure that you've done your best to compile your notes or just organize your stuff from day one, knowing that you're going to need it eventually for third year. There's a program called KMK, and it essentially does that for you. So it consolidates, all of the information from your first 2.5 years and makes these really big books and compiles everything in a very concise way so that you can study. There's another program called OptoPrep, which is just a huge test bank with like over 5,000 questions. So tons and tons of questions. And, these programs, they don't know the board exam, but they know the percentage of questions, if that makes sense. Just giving an example, let's say they say there's going to be 10% of questions on like prescribing glasses. So the material will represent 10% of that stuff compared to there's going to be 50% on pharmacology or 30% on, I don't know, ocular disease. Therefore they will make the book in such a way that it represents like a huge chunk of it's going to be these big sections versus a small chunk's going to be these sections that maybe you wouldn't necessarily get by just studying on your own. So I used those resources. But of course, like if you didn't compile your own notes or at least attempt to remember any of the stuff from when you were actually in the classes, it's much harder to just depend on those resources, if that makes sense. Like you really need to use those in conjunction with your stuff that you actually did during your 2.5 years up to this point. Part two is ocular disease based. So essentially and that was my favorite part because it's essentially just giving you a disease with pictures and telling you how to treat it. So I think for me, that was much easier than the first part, which is asking you tons of optics questions and a lot of math focus. Part two is just essentially what you did in your third year. So, or beginning of fourth year, third year, beginning of fourth year. It's just like, how do you manage ocular disease? That's what it is. It's called TMOD. So the treatment and management of ocular disease. That's what part two is. And then part three is doing a clinical exam. So you do an actual exam on a patient and there's someone, a proctor there that's grading you and you get a certain grade and then you pass. So the best way to practice for part 2 is also KMK, but for part 3, it's just you have to just do a bunch of exams. Thankfully at SUNY, they had test prep rooms that we could just like practice on like classmates and stuff. And it was set up similar to what it would be like for the boards. So we could just go through our script and practice and practice. That's how I practiced for part 3.
Something else I've noticed recently, there are people that even though they're prescribed glasses, and I've seen my sister do it, and I've recently seen someone else do it at a store. Like they'll have glasses, but like they'll look like I don't know how to describe it. Like they won't look through the glasses at whatever they're looking at. They'll just like look but like above it and just like do this instead. Have you seen that with your patients? Have they done that in front
I've
of
seen that
you?
with older people.
Okay.
And
Not
it's
younger
because they're
people.
wearing their reading glasses, so when they look at distance, they have to look above their glasses.
I guess what I'm trying to understand is why would they do that if they have the glasses? Because I'm thinking that's supposed to
Because
help
if
you.
you have reading glasses,
Mhm,
which is only for reading, like up
mhm,
close, and
mhm.
you wanna look at something far away, if you
Okay,
look through your reading glasses, it's gonna be blurry, so you have to look above them.
okay,
Like people that don't have, some people that use glasses all the time, like if, let's say, it's someone in their, much older, they may have progressives, which means that the whole lens is distance reading, distance computer and reading. So they're able to do everything with that one pair of glasses. That person's not going to be looking above the glasses unless they have a bad prescription because they're going to be able to look through the glasses. But some people they don't need anything to see distance. They're 20/20 or 20/30 and they're happy and they don't want glasses. Then if they need reading glasses, then when they want to look at something far, they're going to have to take them off or look above them so that they're not looking through anything to see distance.
okay. So
Yeah.
there is a justifiable reason.
Yeah.
I would make fun of my
Yeah,
mom.
some
I'm like, "Why are you doing that? Like, the glasses are right there, just use them."
no, I have patients that do that and I'll ask them like, "Do you want me to give you a prescription for distance so you can just not do that?" And some people are happy and I'm like, "Okay, as long as you're if it works for you and you're comfortable and
Yeah.
I won't change it."
Okay. Well, thank you for informing me on that. So, hearing you talk about the science, the research, and the joy you find in your work really highlights how powerful eye care can be. But not everyone has the same access to that level of care. And that's where your work takes on an even deeper meaning. Is there anything viewers should be aware of when it comes to eye health?
I think the coolest thing, actually, this is a fun fact that people may not be aware of, is the eye is the only place in the body that we're able to see active blood vessels without having to cut anything. Because when you put drops in a person's eyes, you're able to see the back of the eyes, their retina, which has active blood vessels, you can see. So for people that have diabetes, and a lot of people may not know that they have diabetes, there's actual manifestations that you can see in the retina that a person has diabetes. There's some other conditions that people have that you're able to see in the back of the eye. So example, if someone has diabetes, like I said, you're able to see. If someone has high blood pressure and it's uncontrolled, there's certain changes that happen in the back of the eye that you can see. If someone has HIV, there's certain changes in the back of the eye that you can see. So it's really important that people understand that your eye health is connected to your overall health. A lot of things that happen in the kidneys are happening in the eyes, which is why it's so, so important people that specifically have diabetes that they're getting their eyes checked annually. And if there's change that they get them checked even sooner, more frequently than every 12 months. So I think that's actually very, very cool that you can see those things in the back of the eyes that people may not necessarily be aware of. So for people that have diabetes, sometimes they don't understand why they have to come get their eyes checked. And that's another reason why it's important too, because again, you can see these things in the back of the eyes.
And that could lead to blindness
Yes.
for people with diabetes, right?
Diabetes, if you have high blood pressure, and if it's very, very advanced, that can there's a lot of health conditions that can detrimentally affect your vision just by way of not managing them properly.
So you would say that age and health does impact the frequency of eye doctor visits.
Yes. So like your first exam should really be when you're 6 months old to make sure that there's no gross pathology happening. Example, like if you have an eye turn. So if someone has an eye turn in their 6 months, depending on their eye turn, that could hugely affect their potential vision in terms of if one of your eyes is pointed towards your nose, that should be corrected because then the vision in that eye will never be 20/20 if it stays that way. right? And if your vision's not 20/20 in one of your eyes, then it could potentially impact the future career you want, right? If you want to be a surgeon, you may need certain vision. If you want to be a pilot, you may need to have certain vision uncorrected. So there's certain things like, your first eye exam should be at 6 months old. And then after that, your next eye exam should be when you start school. Again, assuming no gross pathology, no super high prescription that's not considered normal. And then after that, your exam should be every year or every 2 years, again, depending on what's going on. But once you reach, 20, 21, especially if you reach over 40, your exam should be every year because there could be things that are changing in the back of the eyes, specifically like glaucoma. There's no other way to test for glaucoma besides getting your eyes checked, right? People go blind from glaucoma. So it's important to have your eyes checked every year. I would say once you're in school age, it's good to have your eyes checked, especially nowadays with school. So many kids are on the computer all the time that they probably need glasses sooner than their parents did. And, getting headaches and those things, for sure, people need to be getting their eyes checked every year once they start school.
Would you say that it's more difficult to treat someone that has a lazy eye when they're older?
So it depends on how old. There are
Okay.
studies that show that there's plasticity in the brain. So essentially, even if someone has an eye turn or a lazy eye, which is called amblyopia, if they are wearing glasses, they may be able to improve their vision slightly. The critical period is up until 10 years old. So meaning that under the age of 10, if someone has amblyopia, and they're treated, their vision can make huge strides in improvement. After that, it can still improve, so it's always worth it to try. It may not be as significant, but it doesn't mean that it can't improve. Just it may the progression may just be very slow. Whereas, like, if a child that's 3, their vision is very reduced because they have amblyopia, you put glasses on them, maybe in a month or 2 or even 3 months, they're able to improve significantly compared to someone that's older, the progression may just be much slower. But there's no point at which you shouldn't attempt to, wear glasses. But for some people that are in their 40s and 50s, depending on what's causing their amblyopia, having glasses won't improve it. So, example, if I have a patient that's in their 50s and one of their vision is counting fingers, meaning that they can't even see the big E, which most people know, the big E on the chart, and they can only see the fingers. Like if I put the fingers up like this, then correcting their vision, if their prescription is like a -10 in that eye and the other eye is a +2 and they're 20/20, correcting the -10 is not gonna significantly improve their vision because they're gonna be uncomfortable because it's a huge difference in prescription. So it really depends also on how old they are. It depends on what their prescription would be if th to correct their vision to be a little bit better, and then also depends on why they have amblyopia. Is it an eye turn? Did they have a congenital cataract? So it depends on different things as to determine if it would improve or not. And for people that it wouldn't improve, you just wanna make sure that they're wearing glasses all the time to protect the other eye that sees better.
Okay. It's interesting. It's really cool, actually.
Yeah, no, it's quite fascinating.
Do you deal with a few patients that have that?
I have people in mind that I'm thinking about as we're talking, but yeah.
That's really cool. So, what would you recommend for those who can't afford eye care?
So I'd say the great thing about New York is there's so many community health centers that operate through your medical insurance that you don't necessarily need to have like private eye care or eye insurance to cover those exams. I know like at the hospital that I work at, there's patients that don't have eye insurance, but we're still able to examine their eyes for the overall health of their eyes. So I know that the American Optometric Association, I'm sure, has tons of resources for people who can't afford eye care just to have their annual eyes checked. Of course, if you have any sort of medical conditions, like I said, diabetes, high blood pressure, go in through your primary care provider to just find a facility that's able to examine your eyes. But again, the biggest thing would be like just find a community health center. A lot of community health centers nowadays do have optometrists, and a lot of times they'll take people that do not have insurance. And that's the main purpose of these community health centers because they are funded by the government. So a lot of times they will provide all these services even if you don't have eye care or vision insurance, sorry.
That's really helpful to know. So, you've built an incredible career. Now, let's zoom out and talk about purpose and legacy. Looking back, is there anything that you would have done differently or any advice that you would have received sooner?
I was actually thinking about this today, and I would say that something that I would have done differently is I don't feel like I enjoyed the process, meaning I was very focused on the end goal, that all my fun I put to the end in my mind. So it's like, no, I'm not gonna, I never went away on spring break. And I always thought when I was in high school that when I go to college, oh, I'm gonna like go here on spring break, or I'm gonna go there. And outside of not having money, that's just like not the point. It's like even if I did have it, I don't think I would have gone because I viewed fun as something that like it needs to wait to the end. And I do think I had fun along the way. I was always like out with your sister a lot and like having fun, but I felt like I didn't enjoy more in a way that I wanted to because I was so focused on like the end. And I think I could have enjoyed a little bit more along the way because there's always going to be something else. So my advice to myself would be you have to find ways to enjoy along the way because there's always going to be something else that comes up when you get to what you think is the end, right? So it's like, okay, you graduated college, you think now you're going to go on a big trip. But reality is like now you're starting another program, right? Like it's like there's always going to be something. So you have to try to find ways to enjoy along the way or find ways to enjoy, okay, every 3 months I'm going to do something or whatever it is. Because I thought like, oh, once I'm an optometrist, I'm going to do all these things. But then I got married. Then it's like, okay, once I get married, I'm going to do, but then we had a baby like really soon after getting married. So it's like, there's always gonna be something, like, you have to take time to enjoy along the way and prioritize what's important to you so that you can enjoy things along the way. That's, I think, extremely, extremely important, and I wish I would have known that because then I would have had more fun along the way instead of being so down that things are so stressful, which they are, but still being able to, like, find ways to enjoy. And again, I do think I had fun, but it's like, I want to have more fun. So I wish I would have, like, been less hard on myself and enjoyed more along the way and not take everything so seriously. I don't know, but that's not really career related. That's more just like personal. Some things are meant to just have fun with, and that's just enjoy. That's other things. But yeah, I think I should have been more like, okay, you have a plan, you're executing the plan. When anything outside of your plan, you can have fun,
Yeah.
right? It's like, okay, like you have a test and you've planned out your study. Okay, you've done your hours of studying. Now that you're not studying, stop thinking about studying and just have fun. Like, you know what I mean? Like, it's like, I think I wish I would have when I started college, like, create your plan, your semester plan, your class plan so that you can do well, and then once you've executed, "Okay, I'm gonna study for 3 hours today." Once you're done with that, go have fun and don't think about studying because you did what you needed to do because that was your plan, if that makes sense?
Yeah.
So I wish I would have done more of that because I know people that were able to be diligent with that, and to me, they were able to balance it more because those 3 hours was intense studying versus I'm not gonna have fun and I'm gonna study for 5 hours, but really of the 5 hours, 2 hours I was daydreaming.
Yeah.
Like, you know what I mean? Because you're just like, you're not focused because you just had a never ending time of just intense studying versus like, no, I'm gonna do 3 hours of intense and focused, then I'm gonna have fun for 2 hours. You're more productive that way than just like studying, reading something for 5 hours and thinking you're getting anything. After a while, you're just hurting yourself because you're just so tired and you're not retaining anything and you're miserable. So I wish I would have done that. I think I'm trying to, like, do that now in this season of life I'm in. Enjoy along the way and not waiting for the next thing to enjoy. So, yeah.
I love that. And I agree as well. I feel like, since I recently graduated, that was something that I did not stress enough, just enjoying the moment more because I just feel like coming from our background, a Caribbean background, like you just have such high expectations to withhold. So it's just like you want to just mainly focus on ensuring that you meet those goals. So it's kind of like, wait, but this just happened. This, like could have went here, I could have traveled here and blah blah blah.
Mhm.
So I totally understand how you feel, and I do think that's important. That's something I definitely want to make sure in the future with my future children that they don't that they make sure that they live in the
Yeah,
moment as well.
that's really important. I think you have greater happiness and joy when you're able to have a goal, but also enjoy the present. You can't just be solely future focused.
Yeah, we'll change that for the future generations.
For sure.
What keeps you motivated?
Um, I would say now what keeps me motivated is my kids. When I look at them, I just like it's a reflection of like you just can't stop, right? Like you just have to keep going. It keeps me motivated to like want to undo stuff that I saw that maybe wasn't the healthiest. Just like we were just talking about, like there you need to be able to enjoy too, right? So it motivates me to be active in like my change and like being different and not just repeating stuff because I saw it, but being very intentional and mindful about what I'm doing in front of them and how I'm raising them. If my daughter makes a mistake, it's not like, oh my gosh, you made a mistake. And I think that's really important too because they observe a lot and they see a lot of what you do and they repeat it. So just today, like I spilled something and my daughter was like, it's okay, mommy, people make mistakes. And like she says that because I say that to her when she makes a mistake and she's quick to say, "I'm sorry," and it's like, "It's okay, you don't have to say you're sorry, like, it's a mistake, like, how did you know you were gonna spill that?" You know, it's not like you did it on purpose, and it's like the grace I'm extending to her when she makes mistakes, she's able to now extend to others. I think it's just so beautiful that, like, she's essentially repeating what I tell her, but it's
Yeah.
just like so what motivates me is, like, knowing that, like, they're gonna grow up one day, and they're gonna have their own story, and I hope that I can have a positive praying to God that I can have just a positive impact on their story. So when they get older, they can, whatever story they're going to have of their life, like I hope that I've positively impacted that as their mom. So that keeps me motivated in my career to show up, to be the best doctor that I can be, to be, kind to my patients and respectful to my patients and treat them like, as if they were my family. And treat them with, just the respect that I'd want a family member to receive. And also, again, I always feel like, how you show up to other people, it's really important because your kid should never feel like who you are outside is nicer than who you are at home, if that makes sense. So they motivate me to be transparent in all parts of my life and to make sure that my character is the same throughout it all. And that is very motivating because I want them to have a positive view of me, but also I want to have a positive impact on them. So I feel like my kids super motivate me, and because they're girls, it's like I'm looking at myself sometimes.
Yeah.
So it's like it's really really motivating. Like especially when my daughter copies some of the things I do, I'm like, oh my gosh, like it's really a mirror. Like your children are really a mirror to you, and it's a very humbling experience. 'Cause if you're intentional about it, you realize like, "Oh my gosh, I do say that a lot." Or like, like imagine if I was every time she spilt water, I was like, "Oh my gosh, how could you do this? You made" like, so it's because I got some of that when I made mistakes growing up, and like, I was like, "I don't want them to go through the same things." Um, they're very motivating. Helps me to do what I need to do. And also like, in terms of my career, I love what I do. I love my patients, and every patient that I get to interact with, um, they have a positive experience with me. It feels like it reminds me of my purpose. Whenever a patient's like, "Oh, you were so kind to me," or "You were, what, you're one of the best optometrists that I've seen," or whatever the case may be, it reminds me of like, "Oh, this is why you do what you do." Like it's really nice. So my patients also motivate me. And then also, like I said, I'm a Christian and like just wanting to do my best and knowing that God has done so much for me and just being so grateful. So that
Amen.
yeah. So that just keeps me overall very, very motivated. Just to whom I forget the specific Bible verse, or I know the
Mhm.
verse, but I forget where it's found in the Bible. But to whom much is given, much is expected, right? So that's something that like I just remind myself of, right? Like coming from, I'm a first generation American. My parents are from the Caribbean. Like there was much given to me. So there's much expected of my behavior, much expected of just what I put out in the world. There's much expected of that because I was given a lot along the ways. That definitely motivates me, for sure. For sure.
Beautiful. Do you have any additional long-term career goals?
Just wanting to continue to grow, continuing to learn as an optometrist. Like, I really enjoy mentoring. So I do want to continue to do that. I really, really enjoy mentoring because I feel like it's just so important to speak to someone that used to be you in a sense, used to be you in along the journey. So yes, I'd say my long-term career goals, of course, I'd love to continue to work at the hospital. Maybe if owning a private practice is for me, that will come along the way. But I definitely want to maybe go deeper into mentoring because I think that's just so important. And I just enjoy that personal connection you can have with people through encouraging them. So for sure that as well.
I think that'd be helpful too in general, like you said, because there's not that many people that look like us within optometry. So to have someone or more people that look like us that are willing to give their time to provide that space for us to want to continue the path of optometry, that I think that's really important. So I respect that and I love that. So where can listeners find you?
Well, right now I'm a recluse, so it would just be my email. If anyone wants to find me, they can reach out to you, and I'd be happy to share my email with anyone.
Okay, perfect. If listeners can take one thing away from your story, what should it be?
I think it's really important to surround yourself with a great support system. I wouldn't have gotten here without my parents. They were a great support system for me as I was going through my educational journey. It's also very important to be very present in your goals in terms of creating a goal that may seem like you're never going to be able to accomplish it, but just believing that you're going to be able to do it by just hard work. I've worked very hard to get here. I've had many setbacks along the ways. I've also had just many just internal like fears of not being able to do something, and like I said, that imposter syndrome, that's very much a real thing when you're trying to accomplish a goal. So I would say I think the most important thing is have a great support system that can, can encourage you along the way, and of course believing in yourself, but also just like hard work. It does pay off eventually, and I think that that's very evident in just how I've gotten here for sure.
Would you say that the imposter syndrome also showed up during your residency?
For
Where did
sure.
you see it
Oh,
show up the most?
I mean, from day 1 of optometry school until I finished. I think in undergrad, like, there was a lot of people that, like, I don't know, I just felt like I didn't feel like I didn't belong. Like, I felt like I belonged, I could do this. All my close friends were also, like, doing it at the same time, like, from high
Mhm.
school, so it was almost like we were doing it together, even though we didn't go to the same schools, like, the same colleges. When I was getting my master's, I also felt like, "Oh, I got this." Like, I didn't feel, um like I was in jeopardy of not finishing, if that makes sense.
Yeah.
When I got into optometry school, it just felt like this is the last thing. Like this is it. Like, this is it, and then I'm gonna be a doctor, and then I'm gonna be working. It felt just very scary. It felt scary because it's like it's a smaller class size than any class size I've ever been in, right? Like my graduating class in college, who knows how many thousands of people that was, right? But it's like, no, now it's 100 people. And not everyone graduates because some people get kicked out the program because they don't make the grades to make it through. So it was like a lot of like those things, just being really, really fearful, being the only one that looked like me in my class. That was just scary. And not that that means that people that I couldn't make it, but it was just the fear that like, well, there's not so many people that look like me that actually did it. So like, can I do it? It was really that kept playing in my head. But again, like I had a great support system. I had my big who was a year above me, so it was like she finished the year, and she would kept going through. So that was very motivating to see someone else that was able to do it. But I definitely think for sure it was its biggest, imposter syndrome for sure during optometry school. Because again, it was like the last phase of schooling for me. So it was just the fear of, okay, am I actually going to do this now? Like not everyone wants to be a doctor, but am I actually going to be able to do it? So that was definitely hard. But thankfully that's in the past now. And I think that's why mentoring is so important because sometimes people just need to be told that they can do it, right? They need to be able to feel comfortable enough with the mentor that they feel comfortable with to be able to just be honest with like their fears, honest with the things that they're struggling with, and just to have someone say, like, listen, I went through it. I know it's tough, but you're going to get through it. Like, you got to just put your heels in the sand or the ground, whatever that saying is, and just know that, like, you're going to get
It's
through.
on the ground. Is that what
Yeah.
it is?
I- Heels in the sand. It's something, it can't be sand. Heels in the concrete.
Er,
It's supposed to mean like you anchor yourself.
yeah,
But if you put heels in sand, it's not really anchored because sand will
it'll
how
sink.
it will yeah, it will,
I
like
get where you're going.
yeah. So, I mean, like, you have to just, like, purpose in your heart that you're gonna do something, and again, I think with these goals, you just have to have a great support system. Like I said, my parents were very supportive of me in my educational journey. When I was in residency, I got married, so my husband also became a great support system for me to finish my residency. I got pregnant in like, there was just so much going on, in residency that it was just grateful to have people around me that wanted to see me succeed, and I think that's really important, is people around you that they wanna see you succeed. They wanna see you accomplish your goals and will do whatever they have to do to help support you. So that's yeah, that was very helpful in that journey for sure.
Thank you for
Yeah.
sharing that. That's very beautiful. So, before we wrap up, we end every episode with this question here at the Refined Brew Collective. What does living a refined life mean to you right now?
I guess I'll ask you first. What does it mean for you?
For me, refined life is going after everything that I want, not letting fear get in the way anymore, which is why I have this quote that Oprah and I believe Viola Davis also stated, which is everything you wanted is on the other side of fear. And I chose this
Mm,
specific one because of the fact that it has fear
that's
on the
actually
other
really
side.
beautiful. That's
Yeah,
really
thank
beautiful.
you. So a refined life for me is making sure that everything that I've ever wanted to do, I'm not letting fear stop
You.
me any longer. So when it comes to the podcast, when it comes to swimming, taking ballet classes, and
That's so
just
cool.
like, yeah, thank you. And, just taking care of myself, becoming a better version of myself in general. That's what a refined life. is to me right now. Yeah.
Okay, so then I would have to say the older I get, the more I realize it's not fun when you have all these things that you want to accomplish, but you can't stick to a plan to accomplish them. So I think for me right now, like I want to be able to accomplish the goals that I've set for myself because I still have other goals, fitness goals, health goals. Like I still have other goals that I have. And I want to be able to know that I can believe in myself that I can do them, if that makes sense. Because now I have, two little girls who look at me that I want to be able to show them what it means to like accomplish a goal outside of career, just like personal goals. I have self care consistency goals that I would like to have because I'm not consistent with my self care. And like, how does that impact how I show up day to day as a wife, as a mom, as just a person, right? How I
Mhm.
feel about myself. So for me, it means being consistent in the things that are important to me and the things that I know impact my day to day and not making excuses for myself when I slip up and just being like, "No, we're gonna try again tomorrow." Not having too much leeway in me being able to accomplish what it is that I need to do. So, it's being consistent in all areas of my life to accomplish the goals that I have set and knowing that I could do them. So,
You
yeah.
know what's really helpful? I recently started doing a vision board, like, within the last 3 feet.
I used to do those. Yeah, I used to do
It's
those.
so good, I highly recommend them. Someone put me onto it, and ever since then, like, I've done it, and I've made sure to accomplish at least 90% of my goals.
Wow.
So, that's my way of holding myself accountable. Like, there's other ways of doing it as well, but that's just a suggestion.
Oh my gosh, that's so cool. I will definitely I've made one before many years ago. I think before I started optometry school. And that's so funny. Oh my gosh.
You can make them with your family. Like, get a big poster board. I had an extra scientific, why am I saying scientific? You know those science poster
The
boards?
try the try
Yeah. I had an
ah,
extra one from the summer, and I just used that and just started to post, like, a lot of different things that I wanted to do for the year and just things that represent who I am and who I want
oh
to
my gosh,
be.
that's like so cool.
Yeah,
Do you get magazines? Do you print pictures?
both. It's fun, and it's therapeutic too, so I would highly recommend it.
Yeah. No, I think that'd be great to do with like my daughter, my oldest daughter. I think she would like actually really find that fun. And like
Yeah,
find it cute. She probably just put toys on there, but like it just be like cute to like I think that's a great thing because it's like you're essentially it's a daily reminder of like what you're envisioning, what you want. Especially for the year. I like having a year vision board. Um,
exactly, exactly.
that's actually really cute.
And she
Very,
could put
very
her
cute.
hands on there,
Oh
both of
yeah.
your daughters.
Yeah. I like that idea.
Yeah.
I really
I'm glad. Okay, so thank you, Monique, for joining me on this episode of the Refined Brew Collective. If you'd like to learn more about Dr. Monique Mohammed-Weeks, you can find some articles written about her on the SUNY Optometry Educational News, Woman in Optometry, and the SUNY Optometry Vision Board. See you all in the next episode.
Thank you for having me. It was my pleasure.
Thank you for sharing this moment with me on the Refined Brew Collective. If today's conversation poured into you, take a moment to reflect and pass it along to someone who needs it. Until next time, sip slowly, reflect deeply, and rise intentionally.